There's a lot of running injuries that are caused by a similar mechanism. But specifically, let's talk about hip bursitis. So bursitis is inflammation of the bursa. Bursas are a fluid-filled sac that sit in between tendons that make it so there's less friction. You can either have acute bursitis or chronic bursitis. The place that you're going to feel pain when this is happening is right by your greater trochanter on the outside of your hip, or that bump on the outside of your hip. Before I go any further, this is not medical advice. Be sure to consult with your doctor before doing anything I say here. So acute bursitis tends to happen when something hits the bursa or irritates the bursa and it inflames. Many times in distance runners, you will get chronic bursitis or a non-traumatic bursitis. And this happens due to repetitive trauma to the area.
So essentially what happens a lot in runners is the muscle on the outside of your hip, your glute medius, will get weak. The glute medius's job is to keep your pelvis level when you're on a single leg, and it also helps move your leg out to the side like this. So if you have a chronically weak glute medius or glute muscle, what will happen is your knee will actually tend to track in. And the way you'll know this is happening is if you have a mark of dirt on the inside of your leg, or if in running pictures you kind of just see that your knee is kind of knocking into the other one. You might even feel your knees knocking together. So the best way to help hip bursitis is actually strengthening those glute medius muscles. You can either do that by doing sideline hip abduction. Okay, you could even do a standing hip abduction. Once you advance through some of that stuff, doing single leg stability exercises where you're making sure that your hip, knee, and second toe are all in alignment, that is the stuff that's going to help increase strength on the outside of your hip.
A weak glute medius is the cause of a lot of different injuries in running, notably IT band syndrome, patellofemoral pain syndrome. You could even have, patellar tracking issues, all sorts of different stuff. So again, if you are in pain, consult with your doctor. But if you are looking for runner injury prevention tips and tricks, follow along.